Look, I know you be struggling with trying to put an IV because sometimes, you know, their arms just a little too fat. Or sometimes they don't even have a vein. They may be vampires, who knows? But in this video, I'm gonna show you how to put in an IV so you don't be killing your people. I mean your patients.
So today we're going to learn how to insert an IV. First, you have a flush, and I always bring an extra one. Alcohol pads, caps, in order for you not to have any open ports. An IV extension, the needles, different sizes. Here is a 24 gauge, a 22 gauge, and a 20 gauge, as well as an IV start kit. And of course, your gloves after you wash your hands. So the first thing that you want to see is where does the patient have a good vein in order for us to put a good IV site that's going to last. Usually, I do not go to the antecubital if the patient's going to be admitted, because a lot of times when they are bending their arm, that IV site bends because it is a plastic catheter. So I kind of look at the forearm, and the last place I look at is on their hand. A lot of patients complain that it is very painful on their hand, so I try to avoid it unless I can't find anything else. So usually in the forearm, depending on the hydration of the patient, you'll find a good vein to use. For example, I could easily see that she has a good vein right here. She also has a good vein in her wrist, as well as in her hand. However, another part that you have to take into consideration, just like I said with the antecubital, is that the wrist bends. And this vein right here is right on the wrist bone. So this can also be painful and also is a bendable. When choosing an IV site, you also want to avoid areas that have knots or grooves or veins that have a connecting point, like in this picture, that there are two veins and you see that one spot where they connect, because sometimes it can be a little hard to slide the IV into that vein. IV catheters come in sizes. The bigger the gauge, the smaller the needle. The smaller the gauge, the bigger the needle. That is very important to remember, especially when you're trying to determine which is the best gauge for your patient. For example, if your patient is going to get a blood transfusion, it is preferred that they have between an 18 to a 22 gauge. Remember to always follow your institution's policies regarding which gauge it is preferred for a blood transfusion, IV fluids, IV antibiotics, or whatever it is that you are going to be administering the patient via this IV site. The tourniquet is placed about 2 to 4 inches above the site that you have chosen for the IV site.